And a warm welcome to News Across Nigeria. I'm Melinda Kinlami. Coming up on the program, World Food Program to support Yobe state government in the rebuilding process. Federal government, World Health Organization and other donor agencies to administer vaccines to cholera patients in Borno State. Then we move to Cross River State, where the government has begun rice production. The Yobe State Governor, Ibrahim Gaidam, is seeking support from the World Food Program, WFP, in rebuilding the state. This request was made when the country's director, Ms. Marta Kulad, visited him at the government house in Damaturu, the state capital. The WEF country director told the governor that they will work with him in the area of food security.
Insurgency in the northeast has left on its trail tons of displaced persons exposed to serious deprivation. The severity of the situation has attracted the sympathy of various organizations, including the United Nations World Food Program. Our delegation this time around to the government house is led by the country director, who said she had come to familiarize herself with humanitarian activities in the state and also seek for guidance that would aid their operations.
We're trying to support in meeting the food needs of the people affected by the current crisis, but we also hope to be able to support more in general Nigeria in addressing its food security challenges. So we distribute food, we give cash, we focus our assistance on children, and primarily really we try to help achieve the local and national priorities that you have.
The state government and other stakeholders.
Responding, the governor appreciated the concern of the World Food Program towards alleviating food security challenges among IDPs in the state, but also requested that they scaled up their activities.
I commend the efforts of the World Food Program in providing help to the IDPs in the state through the provision of direct cash assistance to over 1,250 households in Guru and Geshwa, as well as registering additional 1,500 households waiting to be provided with cash assistance. The program has equally rendered assistance to IDPs in Gaidam and Busari local governments in the form of seeds, cash support, and other agricultural inputs to enable the IDPs engaged in agricultural production.
With over 2 million internally displaced persons in the northeast begging for attention, an extension of a helping hand such as this would no doubt count for a great deal.
To health matters now, the federal government of Nigeria, in collaboration with the World Health Organization, WHO, and other partners, plan to vaccinate over 900,000 people affected with cholera in several local government areas of Borno State. The Nigeria Center for Disease Control, NCDC, and the National Primary Healthcare Development Agency is partnering with other agencies to support the Borno State Ministry of Health to ensure that the current cholera outbreak is contained there. Many people were found to be having cholera in Muna IDP camp on the outskirts of Borno State, which houses over 20,000 people who have fled the Boko Haram conflict. The number of suspected cholera cases has also gone up in Adikwa and Mungudu areas in the past few weeks. And still on health matters, cholera is an infectious and a fatal bacterial disease of the small intestine, typically contracted from infected water, causing severe vomiting and diarrhea. This deadly disease has since last month found its way into Borno State, northeast Nigeria. To reduce this, the state government has begun a 5-day cholera immunization campaign in the affected communities, and about 1 million people are expected to receive the vaccine. Joining us to discuss this further is Dr. Tope Olubodu, a public health physician at the Lagos University Teaching Hospital, LASUT. A warm welcome to the program.
Thank you.
Now, what is vaccination?
Vaccination refers to giving an antigen into a person, and it helps to develop antibodies that fight the infection in that antigen. And it helps to prevent infections and build immunity against infections.
Now, what do you think people can do in IDP camps, especially to prevent or contain the outbreak of diseases such as cholera and yellow fever?
Yeah, basically to prevent transmission and to prevent infection is to maintain high hygienic standards. The people have to ensure they have good hand hygiene. They wash their hands after using the toilet. They wash their hands before cooking. They wash their hands before eating. And they also make sure that they don't defecate in the open. And even when they have to use pit latrines, the government should ensure that the pit latrines are adequately and properly constructed.
But considering that it's an internally displaced people's camp, I know it will be a big challenge to the people, because they could do anything anywhere and they may not have enough water to even wash their hands.
Yes, that's one of the kind of things that promote the spread of cholera, when there's indiscriminate defecation and there's poor sanitation and there's poor water supply. So a lot has to be done.
Now, we know that dirty water is not just any water. Dirty water and the environment, as you have mentioned, can aggravate cholera. So how can the government help in sustaining that clean environment? Because it's really very important we stress on this.
Okay, to sustain a clean environment, it's a task, but it can be done. Starting from the toilets, like I said, it's not necessarily they have water closets. Even they can have pit latrines, but the pit latrines can be constructed in a way that they are sanitary. There's a way that pit latrines can be constructed in a sanitary manner, and also the environments can be kept clean. The people can be health educated. Health education is very important when outbreaks like this happen, so keep their environment clean as much as possible. And the government should also provide cleaning materials to keep the place clean.
And the numbers of those who have lost their lives from these diseases are staggering, especially in Borno State. So what is the first thing the government should be thinking of in order to prevent this disease?
In order to prevent this disease, like they are doing already, vaccination is very important, because it helps to improve the herd immunity. And when the herd immunity is increased, the transmission of the infection reduces. Like I said, health education is key. In any outbreak, the people should be educated on what causes the outbreak and how they can limit the spread of the outbreak.
What about their food?
Yeah, their food is also important, and their water. Like the people that cook their food should be tested. The food vendors should be tested, their stools should be tested, so that if there's any one of them that is a carrier of the cholera, they can be treated appropriately. And then they should also ensure they have proper, safe water.
What about yellow fever?
Yeah, yellow fever, it's happening now in Kwara State. There has been a case in a little girl in Kwara State. And a case of yellow fever is an outbreak. You don't need to have several cases. Just a case is an outbreak because it's contagious and it's deadly. Yeah, to prevent yellow fever, several things can be done. Environmental hygiene, environmental sanitation is key. The environment should be such that it is free from breeding places from the mosquito, that's the Aedes mosquito. We should avoid that potholes are filled, bushes around the homes. It's not the government that does everything. Even the people in their homes keep their homes clean, keep their surroundings clean, sleep under insecticide nets, and screen their windows and doors with nets. All that can improve, can prevent yellow fever. And also, everybody should get vaccinated. Children should get vaccinated at 9 months.
Okay. Thank you very much for joining us on the program. Dr. Tope Olubodu is a public health physician at the Lagos State University Teaching Hospital, LASUD. And we're taking a break now on the program. When we return, we go to Edo State, where the government has begun the destruction of illegal structures. We'll bring you that and other stories on the program. Join us again.